BBC Audio presents The Fight of Our Lives, the revelatory BBC radio series that takes you behind the scenes on the Covid wards of one of Britain's busiest hospitals, Bradford Royal Infirmary. Introduced and presented by Winifred Robinson, this extraordinary audio diary chronicling the amazing work being done by everyday NHS heroes was originally broadcast on Radio 4 as the NHS Frontline.
Hello, I'm Winifred Robinson. Welcome to the first in our series, the NHS Frontline.
I get into work pretty early, and so the only other person in the building tends to be Karen, our long-suffering cleaner. Morning, Karen. We're still alive.
Yeah.
Just.
Professor John Wright is helping Bradford Royal Infirmary get ready for Covid-19. He's a medical doctor, and he's looked after patients in epidemics all over the world. Cholera and HIV in southern Africa, Ebola in Sierra Leone. He's recorded all of the material you'll hear in this programme for BBC Radio 4. He's really busy, but he thinks it's important that we should all know what staff are facing at every level in the NHS.
I'm Karen, and I work for the non-clinical support services on the domestic side.
And we talk about doctors and nurses being on the front line of this response to coronavirus, but actually, by cleaning, you are on the front line, keeping us safe.
We are trying.
Are you worried?
Not about myself. I'm worried about keeping the patients and the staff as clean as we possibly can, really, and trying to get it through to people how important it is to keep washing your hands.
What we're going to hear is his first-hand account, recorded in real time as things happen.
Because your husband works in the hospital.
He does, yeah. He's a linen porter, and he has actually got COPD.
Yeah, so he's one of the high risk.
He is at great risk.
Is he worried about being exposed?
He is a little bit, but he's taking extra measures to protect himself.
This programme is the first in a series that will take you onto the Covid-19 wards as the weeks unfold. We haven't been to the hospital, but Dr. Wright started recording for us on Monday the 16th of March. It was the day the Prime Minister gave the first of his daily televised updates. Boris Johnson warned that the over 70s would soon be asked to stay at home. 36 people had died in the UK of Covid-19 by that day, and the NHS was gearing up for many more deaths.
Over the next few weeks, I will be reporting from my hospital, Bradford Royal Infirmary, about how the doctors and nurses and staff on the front line are preparing for the epidemic and how they cope with the coming tsunami. I dearly hope that this will be a dull and uneventful series of recordings. But in Italy, where they are 3 weeks ahead of us in the epidemic curve, our medical colleagues are reporting how overwhelmed their hospitals are, like war zones. Patients ventilated in corridors, oxygen running out, doctors and nurses falling sick, over 1,000 deaths. In Bradford, we've had 3 patients notified, all self-isolating at home. This is the calm before the storm, and the eye of the storm will be in our intensive care unit.
At this stage, Bradford had only 3 confirmed cases, but the doctors were already making the kind of changes to their own lives that for the rest of us would come later. Dr. Deborah Horner, who runs the hospital's critical care unit, is a mother of 2, married to a GP. They're both essential workers, no question about that.
You worried about your own health?
I think everyone's worried about their own health, and I think everyone's worried about the health of their families. I think quite a few of my colleagues have decided to ship their kids off to go and live with other family members for the duration of this once we start having lots of patients.
Wow.
So I've got a 13-year-old and a 10-year-old.
You think you're doing anything similar?
Yeah, so we're considering it.
So where would you send your children to?
So for me, they go to their grandparents.
You would avoid contact, presumably?
So where my thought process is, actually, if it was just the kids being ill, actually, I'm not worried particularly about the kids being ill and getting severely ill with this.
Because they don't seem to get severely ill.
No, because they're not. But I'm going to need to carry on being at work. I wouldn't be able to justify it to myself to send my sick children with COVID to grandparents who are in their 70s. So then is the decision to send them in advance to reduce that risk.
Sample complete. Ready to continue?